The 15 members of the United Nations Security Council voted unanimously on Friday to impose a sanctions regime targeting those who are deemed responsible for fomenting instability and violence in Haiti. The approved resolution 2653, drafted by the US and Mexico, which is facing its own drug and gang-related security crisis, sets up a committee which will decide on exactly who will be facing sanctions and what those sanctions will entail. It comes 5 years after the last sanctions regime was enacted against individuals in Mali in 2017. Since the assassination of President Jovenel Moïse last July, the country, already suffering elevated levels of violence and gang activity, has undergone a rapid deterioration of its security situation, with gangs escalating their reigns of terror in the communities under their control. Although the committee is yet to begin its work, one name included for specific sanctions by the resolution is Jimmy Cherizier, the former policeman turned leader of a coalition of gangs that has been causing great disruption to everyday life, particularly by blockading access to the main fuel port in Port-au-Prince. Apart from Cherizier and others who actively participate in gang-related terrorism, the sanctions regime is expected to hit those who have been financing the gangs and supplying them with the weaponry that has allowed them to act with impunity. The sanctions will freeze assets held by Cherizier and other targeted individuals, impose travel bans as well as an arms ban, although it is not yet clear by which mechanisms the latter will be enforced. Meanwhile, the political and economic crises in Haiti have been joined not only by a crisis in public health as the current cholera outbreak continues to grow, but also one of hunger. As of October 20th, according to the UNICEF Haiti Humanitarian Situation Report, there have been 142 confirmed cases of cholera with 39 deaths and 1,042 suspected cases, 557 of which have required hospitalization. Meanwhile, for the first time in the country, catastrophic levels of hunger have been recorded, with just over 19,000 people facing Phase 5 conditions on the Integrated Food Security Phase Classification Acute Food Insecurity Scale in September. These 19,000 must contend with famine-like conditions, with, quote, an extreme lack of food and other basic needs, even after full employment of coping strategies. Starvation, death, and acute levels of malnutrition are among expected outcomes for people classified in this manner. Meanwhile, about 4.7 million people, almost half of Haiti's population, are in need of urgent action, classified as either at Phase 3, crisis, or Phase 4, emergency levels of hunger. The situation is expected to continue into 2023. During a press conference also on Friday, UN Secretary-General spokesperson Stéphane Dujarric provided an update on UN Chief Antonio Guterres' recent visit to the troubled country. He said despite the security challenges, UN agencies are trying to provide humanitarian aid to the people severely affected by cholera.
Our UN colleagues and local partners are working alongside the government despite the many operational challenges to respond to the needs of people impacted by cholera. Under the lead of the Haitian Ministry of Health, the Pan American Health Organization has supported partners for the opening of 13 cholera treatment centers with a maximum capacity of 585 beds. As of today, we're told that more than 100 of those beds are still available to treat patients. Oral rehydration points are also being established in impacted communities to treat milder cases and refer others to inpatient facilities. PAHO, in cooperation with the UN system and local NGO partners, are assisting health authorities to train about 150 of its community health workers and is due to train 150 more. They will also conduct risk communications and community engagement activities, as well as the surveillance of reporting cases, notably in Cité Soleil, one of the most vulnerable and impacted neighborhoods in the capital, Port-au-Prince. Our friends at the UN Children's Agency, UNICEF, are supporting the Haitian authorities and partners with chlorine, water purification tablets, hygiene kits, medical supplies such as oral rehydration salts. The agency is also deploying mobile health clinics in Cité Soleil. Our humanitarian air service, the UN UNHAS, is helping to deliver medical supplies to other parts of the country. Meanwhile, we continue to inform people how to prevent getting cholera. UNICEF has launched a series of radio spots, and PAHO has sent out 1 million SMS messages and is due to send out more.